Now, throughout the pandemic, we have reported on the number of deaths the state has attributed to COVID. They include deaths that have been added as a result of what's called a review of vital records. Well, tonight, 7 Action News reporter Kimberly Craig going in depth to find out what that review means and why accuracy is so very important.
For almost 2 years now, some people have questioned the counting of deaths due to COVID. Some have even speculated that anyone who has COVID and unfortunately dies for whatever reason is counted as a COVID death. But that's not how it works. So if someone who has COVID dies in a car crash or by violence or suicide, they are not counted as a COVID death.
There's not much room for folks to be worried that that accident victim or that overdose is being counted as COVID. It's just not the way the system is set up, and it's not the way it works.
Now about the number of deaths reported that are a result of a review of vital records.
State health officials also reporting another 259 deaths from COVID-19 since Wednesday. 136 of those were identified through vital records reviews.
What that means is staffers in the state's epidemiology division have compared information on death certificates to people in their database who have also tested positive for COVID. Part of a delay in counting a death as COVID-related can be due to the time it takes to obtain a cause of death from the medical examiner, and still certain criteria has to be met. Susan Ringler-Cerniglia from the Washtenaw County Health Department says the state's vital record review process is really looking back to see if anything may have been missed.
That initial case at the local level, that is what people sometimes refer to as a death with COVID rather than a death from COVID, that's not going to get thrown into the COVID count, randomly. There's a very thorough and multi-level review before anything is reported and entered by us at the local level as a COVID death.
When COVID-19 is determined to be the cause of death, it is important that it be reported on the death certificate. Otherwise, proper tracking of the pandemic is not possible.
In this video, the CDC offers guidance to public health officials across the country on reporting and coding deaths, including a sequence of medical conditions the person has before dying.
Death certificates provide crucial data on causes of death and are used to document deaths resulting from this pandemic. This can only be done with complete and accurate cause of death reporting.
And that vital review process at the state level is really looking to go back and see where things may have been missed. It's much more likely we're undercounting than overcounting, unfortunately.
Kimberly Craig, 7 Action News.
All right, thank you so much, Kim.